Director, what should I do to take care of myself after flap surgery?
The hospital performs a lot of flap surgeries for pressure sores. Especially for those who use wheelchairs, they tend to develop a lot of pressure sores because they sit and do many activities. This area is a good position for performing flap surgery since we can pull the skin tight. After we cleanly remove the inflammation, we often perform flap surgery. When we do that, I ask patients to refrain from sitting on the toilet for 2 months after the stitches are removed. Manage the time you sit, gradually increasing it while taking care of the affected area. This is the guidance I provide. Just because the stitches were removed during those 2 months doesn't mean the wound is healed. You really have to be careful to sit on the toilet for about 2 months until the flesh inside the surgical site hardens a bit more. I advise patients to hold off on sitting on the toilet for just 2 months. Still, if you really need to sit and use the toilet, you can do so. But if you sit for a long time, the line will press right on the area where the surgery was done. So you need to be careful when sitting on the toilet, and if you're moving around by yourself, you might rub against things during the process. You need to be careful about that. That's why if you had surgery and were discharged from the hospital, if you've had your stitches removed and have been discharged for about 2 months on days when you go out, it's a good idea to use thick foam layered 2 or 3 times. And be careful while moving around. Also, manage your sitting time on the toilet and be cautious. By doing this and taking good care of yourself for about 2 months, you can help prevent the recurrence of pressure sores.